Widow, thank you to all of the speakers for sharing your really powerful words with all of us today. We'll now move into the Q&A portion of the session. And our first question is, please provide examples of incorporating culturally appropriate practices into currently proven suicide prevention efforts. Is there a plan to build an evidence base to evaluate updated practices? Michelle, do you want to start with that one?
I can, but please add. Okay, so culturally, I think people across the Indian country, Native communities, I think Dr. Warren mentioned that we're very diverse, right? So it becomes very complex, and it takes a lot of individualized work and tailoring at the community level. And so first of all, you have to have the advocates to advocate for that, the transformation that needs to occur. And so we need a lot of grassroots energy and support to initiate that. And I think it is happening for the most part. There is an emergence of this effort. And then we're often met with some of those structural barriers, some of the structural racism, the inequity, and some of the discrediting or the disrespect of our approaches because it's not evidence-based. So we have to fight that battle as we meet these centers and these organizations. And I speak this only because of my experience at an IHS hospital where, you know, I was met with resistance when I initially brought some of these ideas forth. And it took years before acceptance kind of set into the minds of how integration might be a possible solution, especially for the unique needs of our communities. So it's a process. I think I'm going to start there, that it's a process. I'm very happy to see that over the years of my career, I can actually see some progress that has taken place. And I see our up and coming young scientists and scholars that are so gifted in their ability to communicate and advocate and write and do research. And I'm really, I guess, just excited to see and watch that unfold. But there are those pieces that have to occur in the beginning. And I think if we all chip in and collectively help, I think we're going to move this a lot quicker. So I'll offer that and then invite the others to share their thoughts.
Can you repeat the question?
Sure. Please provide examples of incorporating culturally appropriate practices into currently proven suicide prevention efforts. Is there a plan to build an evidence base to evaluate updated practices?
So yes, there is an evidence base for some interventions. I think a lot of them are built on designs of connecting elders, culture bearers with young people. One program that we had designed based on one of those methods was a program we called Camp Bigok, where we took a set of 4 culture bearers, and usually we would take out about 20 youth from many villages, bringing them together, and we would split the youth. Some of them would be in the juvenile justice system, but others would be high achieving young people from villages, because we found it was important to have a balance of those youth who are doing really well to help influence the youth that were struggling a bit more. And we would take them out on the land, and we would survive fully off the land, hunt, fish, build drying racks. So they'd be learning cultural skills and cultural knowledge that help them to build self-efficacy as young people, but also then host talking circles in the morning on the land that the youth determine what it is that they wanted to speak about. And so we would focus on the issues that the youth were bringing up with us while we were learning those practices and skills out on the land. And that's just an example of one of the interventions that we had implemented. And you'd have to get back with me later for me to look up a few of those programs that are in that evidence base that's proven. But we're also conducting current research on protective factors at a communal scale within Alaska as a part of the Alaska Native Collaborative Hub for Research on Resilience. And in that study, which is a multi-year study that's also heavily community engaged, so we have a lot of Indigenous leaders at all levels of leadership. That's something I wanted to get to previously. We have leaders at the external advisory committee level. I think it may be one of the first full Indigenous committees serving on an NIH-funded EAC. as well as at a research steering committee level, and then also helping us to conduct the research within the villages. And what we're hoping to have as outcomes of that is an evidence base for showing the connection between a reduction in suicide and these culturally based and community-based protective factors at a community scale. So there is research, I think, that's going on. I unfortunately, I didn't hear the speakers this morning. It was a bit too early for me, and I just got back from my village last night. But we're oh shoot, I lost my train of thought. I started thinking about my village. It was wonderful up there. It's hard to, that's something that is hard to explain too. It's like culture shock. You go from when you're living, you're coming out of your village and you're coming back into a city. Oh shoot, I really wanted to hit on that point too. Oh, at all levels, that's what it was. So, or no. Well, anyways, if I get back to that train of thought, I'll jump back to it later. But I think my point being there, spirituality, that's what I wanted to say. One of the previous speakers this morning, it sounds like, mentioned spirituality, and we've been spending a lot of time with community leaders and elders and researchers talking about how we can really understand the significance and the role of spirituality in mental health and well-being within Indigenous communities. And I won't say we have the answer or solution to that one. I don't know if anyone ever will, but we've been really understanding how significant of a role and a factor that plays for our people. And so we're incorporating that, as well as language, culture, and many other things into that research that we're conducting. And we hope that will serve as a basis to begin to implement and support some of the shift, I think, that a lot of the speakers have been speaking to towards culturally based Indigenous-led efforts for intervention and prevention.
And I don't think I can speak on this very much, but I just think, like, I'm an advocate of our culture first, versus having like it modified into like an evidence base that wasn't designed for us. And yeah, so I'm not sure I can really answer that.
Thank you all. I think many of you have spoken to this already, but another question we have is, what kind of resources can we give to those who feel like they've lost their sense of cultural identity and want to incorporate traditions in their lives?
I can start. So of course, it's going to go back to your own community, your own family as a first point of reference. Ask parents, ask aunties, uncles, grandparents, tribal leaders. So thinking about your own lineage, that might be the best place to start. A lot of times we don't have solid connections, or maybe we're removed from our communities. So there's this other level of borrowed knowledge or integrated knowledge, intertribal knowledge too, that's a source of I guess, Indigenous health and wellness teachings and interventions and ceremony. And with respect, I think there's ways to learn from one another and have some of these cultural exchanges. So I think there are many ways to seek wellness and to find what's right for an individual. But I would say start with family. Respect should be a leading piece. Go with respect, go with offerings as you're seeking this knowledge, because a lot of it's very protected and very sacred knowledge. And a lot of the knowledge keepers are very, very protective of it as well. And so those are my comments. Thank you.
Oh, I was going to say too, like in the similar way Michelle had said, as far as like seeking out your own elders in the community. And you asked the question, and I kind of wondered, like, who was the we? But in the ways in which we can sort of build community. Dr. Peters had talked about like reweaving that fabric of community and how important that is. And in finding ways in which we can do that, but also like allowing our tobacco to lead as well. That's a powerful thing, to be able to, like, on your own, even put down tobacco and ask for your help, but also to let that lead you with your elders. Because sometimes you don't feel as though someone wants to talk to you or feel like you're important enough to ask the question, but you are, and those elders are wanting to be asked. They want to be the leaders. That is their rightful place at this point. But so letting your tobacco lead and letting whatever that is in your ways, as far as like that gift giving. Yeah. But when you asked the question, you had a we in there, and I wasn't sure who the we was.
Yeah, I'll jump in on this one. What really came to my mind with this question was, it's about the journey and it's about the path. And it's why we can't just have like a poster that says cultural values and have them all listed up there in English and expect our young people to somehow interpret that and understand it, from a poster. It's through the experience of spending the time in building the relationships with community, with people, with knowledge bearers that we begin to develop and grow. And I often talk to our young people that it's like you have to grow a hunger for it in you, and then you have to go after it. My grandmother told me a good life doesn't just happen to you. You have to work for it. And that's one of our teachings, actually, from among our people as well. And so those are the type of thoughts that kind of came to mind with that question. And I think that as other speakers have said, like and again, kind of referring back to the story I shared, about one of our current elders, it's like sometimes that path there doesn't always look like the way you thought it might look. And sometimes things might happen differently than you expected. But in there are those teachings and those learnings, like when you make mistakes and you feel bad and you feel hurt, and then you have to figure out, how do you reconcile that relationship and heal it? A part of that is a teaching. And maybe our elders know that, and they know that you're going through that, but they're allowing you to process that on your own. And so it's like in our culture, it's not like everything's just handed to you. And I think that in that journey, our elders are watching, our culture bearers are watching you grow and learn. And then they know when you're ready, maybe to receive some of the teachings, and that you'll carry them and handle them in a way of respect as our ancestors did. You'll become one of those that carries that coal so that you can run ahead of the people and start a fire up ahead, so that we'll be ready for the next camp for the next day. So, I think that's kind of the way our people think.
I also like to say too, like, I think about all the resources that I personally have in our community, like how many of those resources that have grown to be huge resources for our entire community, but they grew out of a relationship with one elder and one second language, seeker. And that relationship that they built grew into, the revitalization of our ceremonies for hundreds and hundreds of people all across Ojibwe country, or the start of immersion programs that serve hundreds and hundreds of adult and baby, second language speakers. So I think like it is really powerful just to, have those reconnections even with one elder. And I think about like, I again, like the audience, I'm a little disconnected with as far as like, if I think about like, if a young person is here, like saying, I want something more and I want to be connected, but I don't know how. It's like, man, that's like their spirit that they talk about. That's the one that's seeking it. And it's such a powerful thing to then follow and to nurture. And even if like you're outside of our community and you want to nurture that person, like, man, encourage that's something really powerful that's happening inside of them. Like that those are their spiritual helpers telling them, go for it. Like, I don't know if as much as we can encourage and provide support for that person to follow that seeking that they're experiencing. And again, I think that was Dr. Evan or Dr. Peter that said to not doing things half measured. Like that's huge in our communities too. Like you don't do things, you put your all into it. It's hard work, but you get so much more out of it. The more you put into something, the more you get out.
Thank you. Our next audience question is, can you talk about or recommend any Indigenous-led land-based programs? This person said they know about hiking, backpacking expeditions, canoe journeys, maybe even hunting for young men. I'm thinking similarly to Outward Bound programs, but with integration of cultural aspects. Is there anyone that wants to start with that question?
I'll just start with a few thoughts on it. One of the dynamics that's occurring, at least with our villages up here in Alaska, is that only some of our young people have those sorts of opportunities. It comes down to how well are your parents doing, how much resources do your parents have to be able to take you out on the land, and do they have the knowledge to be able to teach you the skills and ways of our people. And so unfortunately we have a lot of families and a lot of young people who don't have access to those opportunities. And so it's just a few young people maybe that are getting that more rounded experience coming from our cultural foundation. And so, I think a lot of our thinking, and again, this goes back to kind of the communal scale transformation. Like at one point in time, all of our young people learned how to read the stars. All of our young people learned and understood our directional frameworks of land navigation among our people through our language. All of our young people knew how to hunt and fish and make dried and smoked meat to preserve it, through the winter, and to make the caches, but at this point it's fewer and fewer of our people. And so I think really the question that I sit with is like, how do we build these, what currently might look like interventions that just ultimately become, again, the practices of our people. And it has to do with transforming our educational systems so that they're taught through our languages, that all of our young people learn our traditional stories. They learn how to make snowshoes and canoes and bow and arrow and all the things that are actually really important to our people, because up here we still live off the land. I mean, most of the food we eat comes from the land still. And so you have to know how to hunt and fish and preserve food in order to survive up here to this day. And so I think that those are a few pieces. I forgot the question now that I wanted to start with.
Just as a reminder, the focus of this question is just on Indigenous land-based programs and more about that. I'm not sure if Migas or Michelle, do you want to add anything, or we can go on to the next one? Okay.
Next question. That is not an area of my expertise, so I'm going to defer to Dr. Peter. Thanks.
Sure. Aside from a clinical and treatment level, how can someone who is not Indigenous support and advocate for this population and connect with them without being disrespectful or overstepping boundaries? And I think that's the original question from an audience member. I think this can also translate to research in terms of those who are non-Indigenous. How can they support and advocate without being disrespectful or overstepping boundaries?
I'll just start by saying support and advocating the Indigenous leaders around you and their expertise and reaching out in that way.
Then I will add, I think just being familiar with the culture and the etiquette of engaging with the culture, because sometimes, there are unique ways of communicating or different words or different things that are considered okay to ask about and some things that are not okay. So it's about doing your homework and learning about the community, having resources like cultural experts that you can just bounce questions off of to get those insights. And then just being human and admitting, I don't know this stuff. I might do something wrong or say something wrong, and kind of prefacing your interactions with that admission of not knowing and wanting to honor and wanting to be respectful, but not knowing all of the pieces of etiquette that are required to do so. So it's about being humble, about being respectful, being transparent, being open. And I think if you make that human connection, I think people are very forgiving and people recognize that not everybody knows about these cultural insights. So I think if you come with a good heart, you're going to do well. If you come with respect, you're going to do well. So that's my thought.
Yeah, I want to double back to the last question since you reiterated it. I do want to share one example from one of our villages in Alaska of a land-based program. One of our villages in Southeast, the name of it is Cake. Their community leaders shared at one of our statewide gatherings from the Collaborative Hub for Research on Resilience meetings about the journey of their community, where they were hit with a series of suicides. Many of their young people and the elders in the community came together and talked about what they needed to do in order to intervene in what was happening in their community. And they actually did institute a summer cultural program that all of the youth from their village go to, where they are trained in how to take care of fish. And I don't know all the elements or pieces of that intervention, but it's been ongoing now for 20 or 30 years. And some of our state's most powerful leaders have been coming out of that village. And it makes sense that they have, because of that intentionality of the elders in the community taking that lead and setting that intention. And that was, I think I mentioned that in my remarks earlier. It's like, that's what our ancestors had done in the past when they faced hardship and challenges. I don't want to romanticize the past. When I spoke to it earlier, like the fabric was intact, but it's not like we lived in a perfect world. There were still the challenges that all humans and all animals face. And, as we try to survive on this earth. And so I think that village has a really great example of a land-based approach that they did institute at a communal scale that was very effective in prevention and intervention. And they also did something similar with restorative justice within their community too, for crime that was occurring and relationships that were being broken at a community level through their tribal court. And so I think that there are absolutely are models. They may or may not be evidence-based at this point, but we know that they are effective from within the context of our communities and people. So that's one example I wanted to put out there. And then as far as this question, yes, humility. I'm so glad that Michelle brought up humility. I think when I think about our young people, I think about kind of non-Indigenous people coming into our communities in kind of a similar way. It's like, you have to be really humble, and you have to put in the time to build relationships and understand aspects of culture and community, so that you understand what it means to live in right relationship within our community and in relationship with our people. And I think that's really hard. I think for a lot of non-Indigenous people, especially researchers or people with PhDs and who are highly trained in their very specific area of knowledge, so they know a whole lot about very little, and often aren't trained in a holistic way. And that's the worldview that our people come from. So like, our elders can talk to you about, biology, sociology, psychology, spirituality, ceremony, all sorts of topics, because they had to go through that training, from that perspective of our people's worldview. And then maybe they still became experts in certain areas too, of ceremony or of certain types of practices. Or they're just naturally inclined and skilled in one form of art or craft. And so, they would become specialized in that kind of a way. But I think that really it's about putting in the time to build that relationship and build that understanding, and do your homework ahead of time. There's a lot more that's written now from Indigenous scholars and academics, about our, cultures and some of the things that are happening. And, take the time to read a lot, so that, from the Indigenous community, we're not having to give the Indigenous 101 talk, which we've had to give too many times, and our people don't really have time to do that a lot anymore, especially those of us that are full in on doing this healing, language revitalization, cultural revitalization work within our communities. And so if you come better prepared, then that's something that our people will also see.
Thank you all. I think the next question is for Dr. Khanjan. This person says, this is similar to the last question, how can I, as a nursing instructor, teach my students to provide culturally safe care?
Okay, so in nursing, of course, we all have that directive or recommendation to be more diverse and in our awareness and in our teaching and in our curriculums. But it's hard, it's challenging, again, because of the diversity. So again, it goes back to the homework. It goes back to your own immersion as the instructor, learning a lot, maybe about various cultures or various cultures that you're directly working with or in the communities that you're working with. I think collaborating is really critical and really important, bringing perspectives from different people, different experts that can share their insights. I think a lot of times there's more meaningfulness and richness that comes in if you can bring in people who have those direct experiences. And then just being really sensitive to the learning environment as well. I think sometimes the learning environment can be quite intimidating. So removing a lot of those pieces that are really intimidating and making the learning environment a nurturing environment. And so there's a lot of, I guess, transformation that needs to occur in learning settings to help us understand about how we can become more culturally aligned or culturally sensitive. So those are just a few of the thoughts that I have. I don't know if that addresses or answers what you were asking, but I hope that helps some.
Thank you. The next question from the audience talks about generalizability, and what they're wanting to know is, learning from what you all shared, are there ways that some of these lessons can generalize outside of Indigenous communities, and why or why not?
Okay, I'll take this one first. Yes, absolutely. I think that the Western world is out of balance. It's on a trajectory that's unsustainable. People are disconnected from themselves, from the land, from each other. They're hurting. Some of them don't know they're hurting. And so it manifests in, ways of being that are actually really hurtful of other people, damaging to the land and the animals. And I think within the frameworks of and worldview and knowledge of our peoples and communities, we have a lot to offer about coming home to oneself, understanding what it means to be human, connecting in a healthy way to each other, to the land and the animals, and to get to experience kind of the profoundness in life and being who we are as human beings. And so I think that, absolutely, I think that within the framework of that knowledge and understanding, Indigenous communities have a lot to offer. I think it has to be approached in the right way, because there's been so much exploitation of our people's practices, who we are. And so, how we approach that, again, I speak a lot to the journey and the path being like the most important piece, maybe more important than whatever the outcome is. And so I think that piece has to be, really important to think about, understand, and navigate in the right way as we share, from the knowledge, from the teachings, and think about how this can help others, because ultimately this is like our land. This is Indigenous land. We've been here for thousands of years, like I said, and not only was the fabric of our societies disrupted and torn, but also damage has been done in the relationship now between people who've come to our lands. For us, it's just been over the last couple hundred years, really, up this way. And so there's a lot of healing that needs to be done. There's a lot of knowledge that needs to be shared. And I think we're at the cusp of the beginning of some of that happening with things like land acknowledgements by institutions, and by recognition that we need to have Indigenous scholars within higher education, that we need to find pathways to support our culture and knowledge and language bearers to be able to be certified as teachers within our schools, perhaps through a different pathway that's really a framework coming from an Indigenous worldview. We think about, there's some programs now where elders from the community are the ones who are serving on your doctoral committees, and your defense is fully in your language with your elders sitting there. That would terrify me personally. I'm not there yet, like I think I have another 10 years maybe or more before I'd be prepared to want to sit before our elders and demonstrate knowledge at a doctoral level, perhaps in our language and culture with them, to gain some of that credential. But I think my answer is yes, though. We have a lot to offer, but we need to be very thoughtful and careful with how we approach that.
I totally agree with Evan and his comments. I feel that for example, the Hojong resilience model, it's relevant to humankind. I mean, there are teachings in there really about respect. That's kind of the foundational piece: self-respect, respect of others, respect of nature, the universe. And so there is the capacity for translation and relevance to the global community is there. I also echo the cautions about respect and just attributing that knowledge, the source of that knowledge. Yes, I might integrate some of these practices. I'm not Native, and I'm going to integrate these Hojong teachings in my way of being and my way of living. And just for my purposes and for my wellness and my health. But if you're taking it beyond that or sharing that knowledge, then I would just be sure to remind people to just honor that knowledge and acknowledge the source of that knowledge and just be real respectful. It's not for personal gain, or it's for global health and wellness of individuals, families, and communities. So, yeah. Thank you.
Yeah, it's a hard question to answer, and I agree with you all. I think about even in like an environmental justice or environmental connection piece, like starting there, and how much better of a world we would live in if more people were connected to the land. And that doesn't require using Indigenous culture to do. And I think if we were to start there, like we wouldn't have to have quite yet the conversation about what's the word? You take someone else's culture. But like I kind of giggled at first because I was like, man, it's a weird question, because I wonder if like upon like when settlers first came over, if they were to truly have said, we're going to live like you all, like that would have been a better future than what had happened. But now I feel like it's too late. Now I feel like we are struggling so much to regain with what we've lost because of it, that it's not, I don't personally believe it's okay for white people to try to take on the culture of Indigenous people. But, connecting with the land, like connecting with our, nature and our wildlife and the other life forms that are here, like, yes, everyone needs to do that for us to have a better future.
Yeah, I want to just add that, there's not one path, there's many paths. And really for our people, I think we think about it, and this is why I began in my comments earlier, that the land teaches us how to be in this place that we live. And a lot of our teachings come off the land and spending time on the land. And that speaks, I think, to what Miki's just said too, like it's our relationship, building that relationship with the land where you live. And understanding, just I think about it. When I used to travel to Lower 48 a little bit more, I used to ask people, hey, where does your electricity come from? Hey, where does your water come from? Hey, where does your food come from? And most people in most cities that I asked that question to in Lower 48, they had no idea where anything that came from. And that's like, pieces of how we're relating to the land and the world around us. It was just like everything was just taken for granted. And so what are the pathways to help people to begin to understand have that reconnection with the land where they're at, know the history of that land that you're on, know what occurred there. And but I also agree, like, you know, I don't go out and give a lot of those speeches anymore because we have so much work to do within our own community and among our own people right now. And so that's where our priority is. So just the last thought on there, you know, I think ultimately, like, if you want to know, from my perspective, probably of the paths that are kind of structured paths that are out there in the world, I think maybe Buddhism is the closest to a path that connects or correlates, I think, to a lot of indigenous kind of frameworks of thinking and understanding. I'm not a Buddhist and I don't understand Buddhism in depth, but from what I've heard about it, I think that's the one that has a little bit of it in there.
Thanks, everyone. And one more, I think we have time for one more question. And this comes from an audience member who says, I work remotely with youth in crisis from all over the continent, recognizing that there are geographic and cultural differences for Indigenous youth. What specific kinds of already existing local resources can I look out for Indigenous youth who are seeking cultural connection?
For me, the first things that come to mind are what we used to refer to as YRTCs, Youth Regional Treatment Centers, in the settings across the country. That's one source. They're usually inpatient substance abuse treatment facilities, but they often have programs or events in place to, like, outreach to offer some cultural teaching and learning. So they're one source. Your local mental health department, your tribal mental health department. There's usually programs in place. There are many existing suicide prevention programs that are out there. The Zero Suicide that Sade mentioned in the chat there. So there are resources. Again, it's about doing your homework and checking into the communities that you're connecting with to gather some of that. And a lot of times maybe an internet search about that community to see what exists there, and having a contact in that community that might be able to link you to some of those resources, someone who knows the community well.
Yeah, that's a tough question because, you know, it sounds like the person's counseling young people from maybe across the country or across the nation. And it's so diverse. You know, within the Alaska context, we have a tribal healthcare system that's run by our tribes and our people. Some of those tribal healthcare regional hospitals and centers have programs that are available. Others don't have programs that are available. Some tribes have programs, some tribes don't have programs. But ultimately, I think that what I would encourage young people in that context to do is to seek out people and individuals at a community context that are healthy and grounded in the culture, and also to find community with other young people who have similar interests or desire to want to do better and to learn more. And I think of like a lot of different, up in Alaska context, of Native Youth Olympics, for example, where young people have a chance to learn traditional games and compete with each other, or maybe at a national level, groups like ASIS, American Indian Science and Engineering Society. Maybe that's more at a university level, but there's different youth, some national youth organizations. I'm not as familiar in Lower 48 with what the ones are right now, but I think just getting the idea across to young people that it's important for them to build community with healthy people who are going to be supportive of the path that they're wanting for themselves. Because finding that peer support and that connection to healthy elders, adults, and other peers, I think is a path for them to start to build some stability and to build a community around them of connection that can help them to make it through the hard times.
Wonderful. We're getting close to the end. I'm wondering, to end this panel, I'm wondering if each of you would like to just add one piece of advice for our listeners or ask for an action item to better suicide prevention. What would your one piece of advice or your action item for better suicide prevention with Indigenous communities be?
I'll go first if I can. I would love to see more funding to pay people to learn their language and to learn their traditional ways of life. And I think about young people. There's like programs that provide young people job training, and they give them like internships, and they pay them for that for the summer or whatnot. And I'm like, that could be them learning their language. Like those are the skills. Those are learning how to hunt or gather, how to cook, or how to connect with elders and the rest of their community. Like those are the skills that we need in our communities. Why not have programs that pay those people? And then as Dr. Peter had said, there's our language nests and our parents that are trying to teach their children or trying to immerse their children in the language, to have programs where they're paying, he was saying that their parents were paying into for that program, but why not pay the parents to learn that and then provide those support systems to do so?
Thank you, Megas. I want to mention, not only is the funding important, definitely, for these programs and these interventions that are community-based and informed by the culture, but a prioritization, I guess. So when in my clinical work, being called in for a person who is thinking about ending their life with suicide, they are in so much pain, like the devastation that they feel and their access to some immediate services, the prioritization of that need, we know that suicide is serious, but do we really, really know how much pain these individuals are in? We sometimes meet them with, well, our clinic has a wait list of 3 months, so we'll put you on the list. Or we send them off to an inpatient psych hospital for 5 days, and we expect them to reintegrate. So it's like we're missing the fact that they're in extreme pain. And so somehow we need to really emphasize that we have to somehow find an immediate remedy to match a level of understanding of what that pain is like for them. If they have exhausted all the resources in their life and in their circles, and they say that death is the only option, that they're in a place where they need immediate help, and they need immediate relief of their suffering. So I think that's what I want to emphasize, is like that recognition that what is that system going to look like? Is it going to be maybe a fast track path? Maybe it's going to be, I don't know that the answer is an inpatient psych hospital. There's great safety there, and maybe it's a safe place for a few days, but we need to envision something that's going to alleviate that suffering, that level of suffering that people are experiencing, and provide access to some sort of an intervention or a service. Thank you.
Just want to end with prayer song. Masi.
Widow, thank you so much to all of our speakers for that song. And we're going to now move into session 3, and I'm going to pass the mic over to Dr. Lisa Wexler. Thank you.